What did interdisciplinary care for people with Parkinson's disease look like at your clinic before you became LSVT certified?
So my understanding of what occupational therapists were able to provide to my patients, I really feel was lacking before I started working with an OT who was actually certified in LSVT Big as well as I was being certified. And being able to see the approach to how they were handling things and how they used that same technique of the amplitude and the effort helped me to really work together with that OT. I think prior to LSVT Big, I may have only thought about occupational therapy in a very small realm, and that is to my fault. And this really helped me to kind of open my eyes to see how much really it's not just about one profession in improving the quality of lives in our patients. It's really about having everyone together. So learning about LSVT Big in that OT could do this as well, and then already having an LSVT Loud certified speech language pathologist just kind of tied the package up nicely together.
So I had been certified for LSVT Loud for quite some time, and it was actually before it became an option for PTs and OTs to do. So I actually was really excited when I came to the Dan Aaron Center that the PT and OT were also Big certified. And that was actually something new to me. I'd never worked with anyone like that. So it really did make a difference in my care. I felt more a part of the team. And what I've learned from working with people with Parkinson's disease is that it does take a team. So we have a team that at the smallest might be a neurologist and the speech language pathologist and the person with Parkinson's and their caregiver. But now we're expanding out to include PT, OT for the rehab team and many, many other professionals on this team. So just the opportunity to interact with the team has been really helpful for my own clinical skills and for my professional growth.
So before I became certified in LSVT Big, I was working in an interdisciplinary team. And when I had patients with Parkinson's, what I was told by those around me and by my superiors was, there's not really much an OT can do for people with Parkinson's. It's really more physical therapy and speech therapy. There's not much that they need from OT. And so I felt a little left out and not sure what to do or how to cue. I was expected to more look at equipment, adaptive equipment and durable medical equipment that would be applicable. So kind of more in a prevention and home modification standpoint than actually doing any true intervention. And so in learning LSVT Big and coming to the center and getting to work so closely with Heather and Meredith and with the team and everyone really being on the same page of addressing the concept of amplitude, I was able to take those concepts of motor learning, of neuroplasticity, of challenge point framework, all the different frames that I'd learned about and that sound so great in college, but you're not quite sure what to do with them. They live in a textbook and in a research article. But then it really helped me shape how to approach my patients, whether it was a fine motor task or ADLs or handwriting, and it framed how I treat. And so I felt like there was a place for me in the team and a place for me as an occupational therapist in treating these patients. I always knew there was, I just didn't quite know what it looked like. So it's helped tremendously.